All right, so in our last video, we talked a lot about kind of why your back may hurt, why things would flare up, and one of the things that we mentioned was the idea that an area gets stretched repetitively, like picking a scab until it eventually bleeds or sends pain signals to the brain. Okay, and a lot of that has to do with the way that we move. But the thing to consider there is that oftentimes we're starting in a bad position to begin with, and kind of the movement that we do is going to drive us into positions that end up getting strained. Like in this person here, you can see that she's got a big arch in her low back, and you can see all that muscle tone, and that might be good. Like if she's back squatting and needs to use that to help her to stand up and lift the weight. But if she doesn't get out of that position afterwards, it's going to be harder for her back to rest or relax and kind of return to normal or access the other end of the scale. The same goes for somebody who squats like this, where they're leaning forward excessively and their back is arched. All right, I would bet that their weight is shifted into their toes. They're getting more weight on the front side of their body, and as a result, all the stuff on the back side is like pushing forward, ends up getting strained or seems tight all the time. And so let me give you an example of this. Okay, like me. All right, I'm somebody that I've lifted weights my entire life. Okay, I've been weightlifting since the age of 13. And, I benched and curled for like 5 years before I actually started even squatting. So, and I did it because, one, I wanted to get girls to look better, and two, I wanted to be better at soccer. But if you look at my posture now, and I've done a lot of work, but you still can see that I have this big arch in my back, and I'm relatively shifted forward. Okay, my center of gravity is forward. If I drew kind of a line between my head and my heels, like my body would actually go in front of that line. All right, the other thing you can also see here is that as I'm standing here, kind of like one side of I have more weight shifted to the right side of my body. Kind of my right shoulder, my left shoulder is dropped down a little bit more than my right, and I'm kind of turned towards my right. And so if you look at on the back side here again, you can just kind of see that there's more of a weight shift to my right. And for me, what I experience often, and I work on to not experience every day, is just right-sided low back pain. And a lot of the things that I do are things that I'm going to teach you, eventually through these webinars. But the point is that I exist in a bad starting position, and so on a daily basis, I work to change that starting position, so I'm able to move a little bit better from the start of anything that I do. So it's kind of like a pendulum. Okay, a pendulum should be able to start in the middle and then swing from one side to the other. Okay, and our body is the same way. Okay, we talked about these like cycles of moving from one side to the other. Okay, when we walk, we shift from one side. Then we shift to the other. But if that doesn't happen, if my weight, for example, is slightly shifted in one direction, or my back is arched towards a certain direction, that I never get to the other end because I'm shifted more towards the other end. So the activities that I do, like standing or squatting or whatever it is that I'm doing in the gym, will typically push me further towards this end that we're already closer to. Okay, and once we hit this end repetitively, then again we're picking the scab. So our goal is to get this line back to the starting position so we can move more normally and kind of give our bodies access to more range of motion, overall, so we don't get that jamming in one position. Okay, and really the way that we do that, more than anything else, is going to be breathing. Okay, breathing is the ultimate cycle, because every time I breathe in, my back is going to flex, and my whole, everything is going to fill with air. My chest, my sides, my the back side of my body. And when I exhale, my diaphragm goes up and all the air leaves and my spine comes forward. All right, this is the cycle more than anything else that dictates the movement of the rest of our body. And so if you have a spine problem or a pain problem, chances are you have a breathing problem. All right, and so what we want to do then is we want to breathe in optimal alignment. And so with that, you can kind of see that my head is stacked on top of my body, which is stacked on top of my pelvis. So if I drew a line of gravity through this person, they would look as if they were standing nice and upright. When this person takes a breath, they can breathe in, they can breathe out, kind of all the stuff in the middle of their body is able to move within normal ranges of motion. Whereas if I have somebody, which is often the case, that kind of sticks their rib cage out in front, they're able to get air in to some degree, but they're never able really to get air out, because we can't or I'm sorry, they're not able to get air in as we would want them to, because we can never really drop that rib cage back. And so this kind of gives us the idea that, you know, if we start in a bad position, then we're going to end in a bad position, all right? And that's ultimately going to create this repetitive stress that ends up jamming us into a certain position. Just some other examples of that. So really what we want to do, and what we'll talk about in our last video, is just do some activities to help to position our body in alignment and that helps to line everything up and helps to kind of readjust almost the positions that have been, I guess, altered by posture, life, and time. And there are some, that's, you know, very individual, but at the same time, there are a few activities that we can start to do, you know, on a daily basis to really help with that I will explain in our next video.